There was also a statement put out earlier this week by 9 pharmaceutical companies that are developing COVID-19 vaccines, in which they pledged not to seek approval for their vaccines before they have been fully vetted for safety and efficacy. This letter was widely seen as a response to fears that a vaccine could be approved by the Food and Drug Administration as soon as late October, just before the presidential election. So, Mike, how significant is this statement from the pharmaceutical companies, and does it ease any of your concerns about an October surprise?
Well, actually, I've had the opportunity to participate in several different panels over the course of the past week related to this issue. And what are we really talking about when we're talking about an October surprise or the actual approval of a vaccine and its availability? Let me just start out, first of all, and I'm just calling balls and strikes here, okay? This is not partisan. This is not hopefully judgmental from an emotional standpoint, just as Joe Friday in the old Dragnet show would say, just the facts, ma'am. If you look at these 9 companies, they have a lot to lose in this whole process, not just a lot to gain. If any of the companies come forward with a vaccine that they want approved and somehow it gets approved by someone, which we'll come back to, and there is a problem with that vaccine, we will pay a price in the immunization world for as long as I'll be on the face of this earth. They know that if they're a company that had a vaccine that should have and could have been further vetted, that would have picked up some kind of a problem before it was made available, that there will be a price for them to pay, not just financially. And so it's not a surprise these companies would say this. There clearly are leaders in these companies that have the essence of integrity. I know some of these executives, and I believe that they, in the first instance, would think more about, is this a vaccine that would be safe for my own family members to take, not just what it means for their company. So I'm confident in this. But I think the challenge we have is, how could a vaccine arrive on the scene as an October surprise? And unfortunately, it was that attention was drawn to that point this past week again by the president, indicating that it's very possible that one would be, as he declared it, the big day. And I actually believe that the data monitoring group that will look at these data, which will determine if for some reason there is evidence that the vaccines are highly effective and safe before the election, that they'll come forward with that as an independent board. Remember, we have 500 to 1,000 people a day dying in this country from this disease. We want this vaccine as soon as possible. So if we could have it tomorrow with those kinds of criteria, I would be extremely pleased. But at the same time, if it's rushed and we have this challenge I just mentioned, then we got a hell of a problem. So from my perspective, I believe that the monitoring board will not come forward with a statement of success in terms of efficacy or safety until it's time. I think the FDA will do the same. The FDA surely has been challenged with issues like hydroxychloroquine, remdesivir approval, the issue around plasma therapy. And some would say, well, this one would come through too, maybe with an emergency use authorization. I'm confident that's not going to happen. I think that if a company doesn't apply for an emergency use authorization, there's no way the FDA itself will initiate that. So you can say there really isn't much of a chance of this being an October surprise. And of course, administration officials out of the NIH have been fairly clear about that they too would not support something before it's time. On the other hand, I think we do have to be mindful of the fact that the Secretary of Health and Human Services has the authority to issue an emergency use authorization for this vaccine. And if he should want to do that, even if a company did not want it to be done or the FDA did not want it to be done, he could still do that. And you say, well, but they've got to make vaccine. Well, unfortunately, it appears that under the Defense Production Act, the president could force a company who now has had a emergency use authorization put upon them for the vaccine that was approved. And with the Defense Production Act combination, a company could be made to make the vaccine, even though they had not applied for that. Now, that obviously is still open to interpretation. I hope we'd never see that happen, but we have to entertain that's a possibility. And I think that there would be an outcry from the public health community, second to none, which is my worst nightmare, because we will so confuse the public. What we're saying is there's not enough information yet to determine the safety and effectiveness of the vaccine, that'll be interpreted with that vaccine as not safe, meaning that when we finally do get sufficient information and it might reach approval, the public will be so whipsawed. We owe them so much more. So what I can only hope is we get a safe and effective vaccine as soon as possible, and multiple vaccines. We're going to need multiple vaccines. And that we not have this confusion about, was it rigorously vetted? Has it met the standards of vaccines that if this were a very different time without a crisis would have been handled the same way? I can only hope that will be the case. So we'll keep you posted on this. We're involved in a number of discussions on this issue, and we can only hope that we're going to get to the point where we actually can start vaccinating Americans against this horrible pandemic virus.